Over 60, diabetic, still eating sweets? Avoid this one mistake because that late night bite or even a sweet that leaves you thirsty can undo everything you do to protect your legs. If you're waking up with heavy, stone-like calves, deep sock dents, or ankles that feel like they're holding a bucket of fluid, listen, those signs are not just annoying. They are your legs telling you the veins aren't moving fluid efficiently. That behavior, sweets late in the evening that lead to thirst and then late drinking, creates blood sugar spikes and inflammation, and it drives extra fluid into the lower legs at the very time your body should be draining and repairing. If you want the full 7-step bedtime vascular revival, a simple physiology-based routine you can do in your bedroom that targets electrolytes, the muscle pump, venous tone, and fluid timing. I'll give the exact timing and rationale for each step, plus the safety warnings you must follow if you have kidney disease, are on blood thinners, or take diabetes medications. Don't skip the safety notes. They matter. Now let's go step by step so you can do this tonight. Step 1. The pre-sleep cellular flush. About 60 minutes before bed, take a magnesium citrate drink that supplies roughly 300 to 400 milligrams of elemental magnesium and add a pinch of cream of tartar, about a quarter teaspoon, for a small potassium signal. The idea here is not a magic pill, but a gentle nudge to your cells. Magnesium supports smooth muscle relaxation and vascular tone, while the potassium signal encourages cells to release sodium and water. That cellular shift helps reduce extracellular fluid that otherwise collects in the ankles and calves. Make the drink with a glass of water and a flavored magnesium citrate powder or capsule dissolved per product instructions, mixed with the tiny amount of cream of tartar. If you have reduced kidney function, are taking potassium-sparing medications, are on diuretics, or have complex diabetes medication regimens, check with your clinician before doing this. Both magnesium and extra potassium can build up in people with impaired kidney clearance. Also be aware that magnesium in this dose can cause loose stools in some people. Start on the lower end and adjust with advice from your clinician. Mini hook. This first step primes the tissue, so the next moves actually shove fluid out, not just redistribute it. Step 2. Contrast foot baths. You're going to use hot, then cold to trigger the body's natural hunting response. Prepare 2 basins or 1 basin with a way to alternate water temperature. Start with 3 minutes of comfortably hot water, hot enough to dilate superficial vessels, but not so hot that it's painful. Then switch to 60 seconds of cold water, brisk, not freezing, to evoke vasoconstriction. Repeat this cycle 3 times and finish on the cold plunge. The alternating hot-cold cycles cause the microvasculature to rhythmically constrict and dilate, creating a pumping action that helps move fluid out of the lower tissues and back into central circulation. If you have severe peripheral arterial disease, neuropathy with reduced sensation, open wounds, or other serious circulatory problems, consult your clinician before doing contrast therapy. Don't risk a burn if you can't feel temperature properly. Breathe slowly during each cycle. Yes, it can feel intense. That final cold plunge is the key to forcing the fluid back up. Mini hook. Step 2 looks extreme, but the ice plunge is exactly how you force the veins to push fluid back into circulation. Step 3. Active legs up the wall pump. Lie on the bed or floor and elevate your legs so the soles point toward the ceiling, legs up the wall style. Stay elevated, then do ankle pump sets. Point your toes away from you and then flex them toward your shins. The rhythm I recommend is 10 5-second point flex cycles per minute for 5 minutes total. That means each cycle is about 5 seconds of pointed toes, 5 seconds of flex, repeated with a steady tempo. Across 5 minutes, this engages the calf muscles enough to mimic a manual lymphatic massage and dramatically improve venous return. The calf muscle pump is your natural venous heart below the knee. Activating it before sleep shifts pooled fluid centrally while gravity and circulation are still favorable. If you have severe foot or ankle pain, joint restrictions, or severe neuropathy, modify the range of motion or ask a clinician for an alternative. The goal is repeated contraction of the calf muscle, not forceful strain. Mini hook. 5 focused minutes here equals a professional lymphatic session, and you can do it lying down.
Step 4. Venotonic topical massage. Mix 5 drops of cypress essential oil and 5 drops of rosemary essential oil into 1 tablespoon of a neutral carrier oil, such as fractionated coconut oil or jojoba. Warm a small amount between your hands and, using firm upward strokes from the ankle toward just below the knee, massage both lower legs. Always stroke toward the heart. That direction helps move fluid into larger veins and towards central circulation. Finish the massage below the kneecap and avoid deep pressure over the shin bone. The cypress and rosemary are traditional venotonics. They support a feeling of tone and can be calming for the vascular bed when used as an adjunct. Do a gentle check for skin irritation on a small patch before applying broadly, and if you use medical medications or have fragile skin, consult your clinician or pharmacist first. This is not a replacement for medical-grade therapy, but it's an effective low-risk adjunct for many people. Mini hook. This simple rub boosts venous tone and gives you the tactile feedback that the legs are moving. Try noticing how the tissue feels before and after. Step 5. Nighttime light compression. After the massage, put on low-grade travel compression socks rated between 8 and 15 mmHg. These are gentle, meant to support venous return without squeezing like a medical-grade garment. The logic here is subtle support, a light external pressure that prevents fluid from receding in the lower leg while you sleep. Do not use daytime therapeutic compression levels 20 to 30 mmHg or higher overnight, unless specifically prescribed by your clinician. High-grade compression without medical supervision can act like a ligature, especially if it's rolled down or too tight on a leg with neuropathy. Check that the top edge sits below the knee crease, that there's no pinching, and that you can still move your toes and feel sensation. If you have arterial disease, severe peripheral neuropathy, or are unsure, get medical clearance before using any compression. If your legs feel numb, excessively cold, or painful after putting them on, remove the socks and consult a clinician. Mini hook. Think of these as a gentle overnight assist, not a daytime medical garment. Step 6. The 3-hour fluid fast. Stop large volume fluids 3 hours before your planned bedtime. This is crucial. It gives your kidneys a window while you are still upright to process and excrete excess water. If you drink big volumes within an hour of lying down, your kidneys can't offload that fluid efficiently when the cath pump is idle and gravity lets fluid pool in the ankles. Allow only a small sip if you need to take your supplements with a tiny amount of water. Otherwise, front-load fluids earlier in the evening. For people with diabetes who worry about overnight hypoglycemia, discuss timing with your clinician. This fasting strategy must be balanced with your glucose management plan. If you're on diuretics, time those under clinician guidance as well. Don't self-adjust medications. The principle is, give your body time to process fluid before horizontal rest. Mini hook. This simple timing change, stop big drinks 3 hours before bed, is one of the single most effective behavioral tweaks to reduce morning puffiness. Step 7. Nighttime venotonic supplements. At bedtime, consider supportive oral venotonics if they are appropriate for you. 2 commonly studied options are standardized horse chestnut seed extract and pycnogenol. A common regimen used in studies and clinical practice is 300 milligrams of horse chestnut seed extract, standardized to its acene content, combined with about 100 milligrams of pycnogenol. These supplements are thought to support capillary integrity and venous tone overnight while the body repairs itself.
Important safety caveats. Do not start these without discussing them with your clinician if you take anticoagulant medications, as horse chestnut and pycnogenol can affect bleeding risk. Check product standardization and quality. Look for third-party tested formulations. If you have liver disease, kidney problems, or are on multiple medications, get clinician approval. And avoid combining these supplements with other herbal products that affect clotting unless cleared by your provider. Mini hook. These are supportive tools, not cures, and they must be used with medical oversight when you're on blood thinners or have complex health issues. Now, practical timing and what to expect. Do steps 1 through 3 roughly 60 to 45 minutes before bed. Complete step 4 and put on the light compression socks about 15 to 10 minutes before sleep and observe the 3-hour fluid fast window. Take supplements at bedtime after you've completed the topical work and compression application. This sequencing matters. Electrolyte priming first, mechanical pumping and vascular activation next, topical support and light compression last, so that when you lie down, the fluid is already offloaded and the body can repair during the overnight repair cycles. What you might feel immediately and what is realistic to expect. Some people notice morning lightness in the legs within a few days, less indentation from socks, less tightness around the ankles. For many, consistent nightly practice over weeks produces more reliable results. This routine reduces the nighttime accumulation of fluid and supports better vascular tone, but it's not a guaranteed reversal of chronic venous disease. Continue routine care with your clinician and use this protocol as a supportive nightly habit. Now, let's return to the single behavioral mistake that inspired this whole message: late-night sweets. It's not necessarily the sugar itself that's the full problem, it's the chain reaction. A sweet eaten late often causes a rapid blood sugar rise, which transiently increases inflammatory signals and capillary permeability. That spike makes tissues more likely to leak fluid. At the same time, sugar triggers thirst for many people, so a late sweet is frequently followed by extra evening drinking. That extra fluid, taken while you're sitting or lying down, gives the kidneys too little time to remove it, so it pools in the lowest parts of the body, your lower legs. Every step of the nighttime protocol is designed to prevent that pooling. But if you keep triggering the chain with late sweets and late drinking, you'll be fighting the tide. Move sweets earlier in the day or skip them in the evening. If you do want a small treat, pair it with a low-volume option and try to have it at least 3 hours before bed so your body has time to process the load. Behavior tips to make this stick: plan an earlier cutoff for snacks. Replace evening sweets with herbal tea or a small protein snack earlier in the evening. Set a visible water bottle with timed marks to help you front-load fluids earlier. For many people, swapping a nightly cookie for a small handful of nuts earlier in the evening reduces both the sugar spike and the late thirst. A few extra bedside rules and safety flags. Sleep position matters. If you sleep on your side, place a small pillow between your knees to avoid crossing legs and compressing veins. Avoid long sessions of sitting in a recliner with legs down before bed. Stand up and walk for a few minutes after evening activities to engage the calf pump. If you notice warning signs, sudden unilateral swelling in one leg, severe new pain, localized warmth or redness, stop the protocol and seek immediate medical evaluation. Those could be signs of deep vein thrombosis and require urgent care. Likewise, if you have kidney disease, are on anticoagulants, take multiple diabetes medications, or are pregnant, check with your clinician before starting any supplement or electrolyte routine. Let me emphasize the safety parts again because they matter. Magnesium and additional potassium can be harmful in people with kidney impairment. Horse chestnut and pycnogenol may interact with blood thinners, so don't start them without clinician approval. Compression should be light overnight unless prescribed at a higher grade. If you have diabetic neuropathy, test any hot-cold protocols carefully and start on milder temperatures so you don't risk burns or cold injury. If you've been doing everything else right, walking, weight management, leg elevation during the day, but still wake up with heavy ankles, look at your evening habits. The single simple mistake to avoid is late sweets that create that thirst and spike pattern. Fix that behavior, then add the 7 steps consistently, and you'll give your legs the nightly environment they need to offload fluid and begin repair.
Quick summary to tuck into your head. 1. Pre-sleep magnesium plus tiny potassium signal about an hour before bed. 2. 3 cycles of hot for 3 minutes and cold for 60 seconds, finishing cold. 3. 5 minutes of legs up ankle pumps with 10 5-second cycles per minute. 4. Venotonic upward massage with cypress and rosemary diluted in carrier oil. 5. Light 8 to 15 millimeters per mercury travel compression after massage. 6. Stop big fluids 3 hours before bed. 7. Consider nighttime horse chestnut seed extract standardized to ASIN at around 300 milligrams plus 100 milligrams pycnogenol, but only with clinician approval. Keep safety in mind. Kidney disease, anticoagulants, diabetes medication interactions, and suspected DVT are all reasons to pause and consult. If you try this tonight, track the change. Note how your socks feel in the morning, whether the pins and needles or tightness eases, and whether swelling is less prominent. Small nightly wins add up to meaningful improvement. One final reminder about sweets. If you're over 60 and diabetic, it's not about complete deprivation, it's about timing and volume. Move sweets earlier, decrease late-night fluid consumption, and stop the spike and sip cycle that pours fuel on venous pooling. The 7-step routine counteracts the physics and biology of fluid accumulation, but it works best when you stop feeding the problem by sipping late-night volumes triggered by sweets. Watch the next video I've put together. It details the 3 foods silently damaging vascular elasticity and how to replace them with simple swaps. And before you begin any of the supplement or electrolyte parts of this routine, check with your physician or pharmacist if you have kidney disease, are on blood thinners, or take diabetes medications. If you have sudden unilateral leg swelling, severe new pain, localized warmth, or redness, seek urgent care. Try the routine tonight, be consistent, and observe the morning differences. And if anything doesn't feel right, stop and consult your clinician.